The House Oversight Subcommittee on Public Health and Food Security will come to order. Would the clerk please take the attendance?
Chair Beerline.
Here.
Representatives Paquette.
Here.
Green. McDonald.
Here.
Cerniglu.
Here.
Mr. Chair, you have a quorum.
Today we're going to have a presentation from Trinity Health Michigan on their Food is Medicine program. From Trinity Health, we have Katelyn Smoger, Director of Farming and Healthy Lifestyles. So Katelyn, whenever you're ready, if you'd like to come up and present, I appreciate it.
Thank you all so much for the opportunity to share our program with you. As Representative said, I'm Katelyn Smoger. I'm the Director of Food is Medicine in the farm at Trinity Health, or Farming and Healthy Lifestyles, whichever title you want to throw on there. It works for me. We're so grateful for the opportunity to talk about our Food is Medicine programs. Trinity Health Michigan has been working to address food security and food insecurity in our communities since 2010. And some of you may know that we actually have a farm at 3 of our hospital locations, and I often lead with why. And we conduct a community health needs assessment every 3 years, and for us, this looks like going to district meetings. It looks like door knocking throughout the community and just gathering as much input as we can from our community members to ask them what they feel it would take to make their communities healthier. And at many of our ministries, we have found that access to food, especially healthy, nutritious, fresh food, is a constant concern. And as you can see on the very teeny tiny text onto the right side, anything that's showing up in green is where we have found food access issues to be in our top 3 concerns for that particular health ministry. So Ann Arbor, Livingston, Oakland, Livonia, and Muskegon all have identified food insecurity as a top concern in their community. And we know that there is a correlation as a healthcare system between a person's access to healthy, fresh, affordable foods in their community and their quality of life and their longevity of life. And what you can see before you are 2 different maps pulled for our Ypsilanti community. The areas in red are surrounding our hospital and are where we have a life expectancy at just 65, where you are looking in the areas highlighted in orange and yellow on your right-hand side. We are overlaying this with the USDA Food Access Research Atlas. So this is what you would have formerly identified as a food desert, are areas of low income and limited access for our residents. This becomes even more stark when we look at our Pontiac ministry. So you can see almost a direct overlay and a 20-year life expectancy gap between one of the most affluent communities in Michigan and one of the most challenged ones when it comes to food access. So we understand the importance of food is medicine and creating access in our communities. In Muskegon, you can see the same data outlined here. So we have a farm at our 3 locations, and we're looking to continue to build this out across our footprint throughout the states. Our farm at Trinity Health Ann Arbor was started back in 2010. The farm at Trinity Health Oakland was started in 2020. And the farm at Trinity Health Muskegon McLaughlin Groves was started way back in 2009 by a community-based organization. And our hospital's leadership team identified the importance of maintaining this kind of core access in the neighborhood where the farm is located. And when the previously operating community-based organization folded, leadership kind of took on the responsibility of making sure that we would continue to be an access point in the community. So they joined our Trinity Health Michigan family in 2024. The slide that I'll spend the most amount of time on with you all is talking about what we really think of as our spectrum of intervention for addressing nutrition security for our patients and our community members. So we grow food at the hospital, and one of the most common questions that I get is, what do you do with all of that? And the answer is that we provide this to clinics throughout the hospital and throughout the community. Many of them are FQHC partners. And we do this to drive food insecurity screening as well as health screening. So those social influencers of health are so critical to making up what a person's health span or their lifespan can be. We know that it is up to 80% of what your quality of life and your quality of health can be is attributed not to things in just your medical care, but where you grew up, what your access to food looks like. And so having those conversations as a provider can be incredibly difficult. If you have been to a physician's office lately and you are being asked, how are things at home? Do you have access to food? In many instances, when health systems are collecting this required data, it may just be a reference to something that's printing off at the bottom of your chart, and we say, that patient has the vulnerability to say, I don't have access to food at home, or I don't have food that looks like this consistently. You're telling me to eat healthy, but that's not something that I feel like I can do. And in many instances, it's just turning around and putting that note in the chart, and then your patient is not building trust with you, right? You're not helping them solve this problem. But when a patient comes to one of our partner clinics or to a Trinity Health clinic that's participating in our Produce to Patients program, you're able to then have a more authentic connection with that patient and help them understand how they can access food that looks like this in their community and send them home with it. So we have little mini fridges that are set up inside of our clinics, and that's where the 80% of the food that we grow goes. And so the next time you go to visit your primary care provider, if you see a little fridge in the office, you can know that we grew that food at the farm, and we're hoping to drive those SIOH screening questions. Now, if you have come to your physician's office and you have said, I have difficulty affording enough food that is fresh and healthy, or maybe I can afford it for my kids, but not enough for myself, we want to create equitable access for addressing nutrition security right in our communities. So we have on-campus food pantries that we have put into our Ann Arbor and our Pontiac location. We're working on adding Muskegon as soon as we can. And then we also run farm stands right at the hospital every week when we're in season, April through December. So a good portion of the food that's not getting donated is being sold. We've worked really hard to make sure that we accept as many methods of payment as we can, everything from SNAP and EBT to prescription for health to, I heard someone say, Senior Project Fresh when Sean walked in with this. So we work with as many programs and organizations as we can to drive that access to our programs. And then our Farm Share program. So that's what I have here. And I've had many people come up and ask what's in here. We have collards from University of Michigan Campus Farm, lettuce from Sealy Farm. We have organic oats from Gates Farm, ramps from Monroe Family Organic. There's some apples in there. So this gives you an idea of what participants in our Farm Share program are getting week after week. It is a 36-week-long box program, and we ensure that we are investing in the regional food system when we are creating this program. So we purchase food from farms at wholesale prices that those farmers set themselves. We have strong relationships with our farmers who are providing food for our program. And then my food program coordinators are working to pick out something that they think is going to make a whole and complete meal for your family. So we are going to send you home with recipes. We send you a newsletter the week ahead letting you know what is going to be included in your share, the farm that grew it. We think it's really important to maintain that relationship. We're never going to say, this is the Trinity Farm Share brought to you by Trinity, unless it is something that we grew at our campus. We're always going to make sure that we're creating that connection between a community member and where their food was grown as a part of our Farm Share program. And then we have our education and empowerment that's really woven throughout. So we offer summer camps, field trips, cooking classes, and demonstrations. And then I also have made an attempt to make sure that we are connecting with both our medical students and our medical residents. They receive very little in the way of education when it comes to things like nutrition or understanding the connection of your zip code and your life expectancy. And so for us, we want to make sure that we are meeting as many individuals as we can at all walks of life, whether you're a kid coming on a field trip or you are a medical resident preparing to have 1 million encounters over the course of your career. We are making sure that we're bringing the lesson that food can be medicine and helping our patients and community members address chronic health conditions before they're ever even having a chance to develop them, and hopefully reverse them if they are diagnosed. So I want to give you a sense of scale for each of our programs. So our Produce to Patients program, this is the one where we grow food at the hospital and then donate it. We had 21 clinic partners throughout the state in 2024, and we served 20,000 patients with food from our farms, which we feel is really incredible in helping to change the narrative and the conversation. And then just to give you a better idea of what our in-hospital farm stands and food pantries look like, they are client choice, and we want to make sure that individuals participating in this program have the dignity of being able to supplement the fresh food that we have picked out for them. We had more than 4,000 food pantry shops in our Ann Arbor and Pontiac locations last year alone, and more than a third of our farm share assistance members, so individuals who receive this program at no cost due to experiencing food insecurity, stated that they rely on our food pantries for at least half of their food need, and we're just very, very small food pantries within our community. And then the farm share, so this is our box program. We have 6 to 8 locally grown fruits and veggies. Like I said, we're always going to tell you who grew that food for you. We run April through December, so we've been at this for a couple of weeks already. We offer 5 pickup locations throughout the state of Michigan, with 2 ways to pick up your share. We do a community distribution, and this for me is a lot of fun. We have the ability for you to pay to participate. So I have physicians and nurses and healthcare executives who can buy into this program, and they're going to get the exact same program that somebody who has come to one of our providers or self-referred into our farm share assistance program, and they're not paying anything for this. And you have the opportunity to see these 2 groups mix and have a conversation about, what are you going to make with collards tonight? Like, I don't know. And so these 2 groups who would never have an opportunity to connect are connecting at our distribution and just sharing their own experiences and talking about the efforts that they're making to make their family healthier. So there's a lot of community building that is happening that we attribute to part of the success of this program. And then for those who are not able to come to that community distribution time, we know that everyone has different schedules and life is really busy. I'm sure that you all know more than most people that that's the case. We offer a 24/7, 5-day pickup window each week from Wednesday through Sunday night. So we work really, really hard to drive that access. And then we are committed to ensuring that this is not just a feel-good program, that we are making a measurable difference in the outcomes of the health of our patients and those who participate with us. So Michigan Health Endowment Fund supported the evaluation of our program for all of 2024. We collected pre- and post-surveys from more than 300 individual participants in this program, and they found that the farm share had clear positive impacts on food behaviors and health outcomes, and full season participants had statistically significant increases in food security, average daily fruit and vegetable consumption, and their overall perceived health status. So we're really, really proud of these metrics and just wanted to share some of that with you. So we impacted around 1,600 people across 11 counties and by serving 572 direct members. So this is kind of taking their family size into account. And for every one of those participants who participated in that full 36-week program, we found that each one of them was having, on average, a 1/3 cup more fruits or vegetables per day. So over the course of this program, that's more than 75 additional servings of vegetables, which is absolutely incredible. So we're really, really proud of this. And we also saw a significant change in the overall food security status of our patients, which can be a very difficult needle to move. So we are happy to share with you all this report. If you would like to dive in more beyond this executive summary here, and this is just some figures kind of highlighting what I had said, that When we started the program, 80% of those who participated in our farm share assistance program were very food insecure. And by the time we concluded this program, that number had dropped to just 55%. So really, really excited about that. And then 90% of our farm share assistance members stated that at least half of their weekly produce was coming from our farm share program. So the difference that it makes for those families who are able to participate in a program like this has significant impact for them. And then we, like I had alluded to earlier, also really care about investing in the regional food system. We think that you cannot run a food as medicine program ethically without making sure that you are sourcing local first and supporting that regional food system to continue to drive economic growth and opportunity in the very communities that you are working to help improve. So we saw out of 11 farmers that submitted surveys back to us, 100% of them increased their gross sales. 9 of them gained more reliable income, and 100% of them saw improvements in their farm in at least 3 of the ways listed here. So really, really excited that this is creating opportunity for those farms to be able to have a ripple effect of this work outside of just our health system. And then our education program creates opportunity at every age. We, like I said, have summer camps, field trips, classroom visits, medical student and resident rotations, but we also care about the impact of this program as well. So we had 1,500 encounters with students primarily from Ypsilanti and Lincoln Consolidated Schools in 2024. 90 summer camp participants from all walks of life. We offer scholarships for those students who aren't able to afford it. And we have an educator on staff, Laura Meisler, and she is having 5 touch points with the 5th graders in those 2 school districts to help those teachers meet NGSS science standards around everything from what are plant sugars? Are they as good for me or bad for me as sugar that might be found in soda? And so we're meeting health requirements, and we're helping kids understand everything from how the food that they're eating impacts their body and helping them want to try new things. There's nothing like having kids out to the farm and watching them pull a carrot out of the ground for the first time to understand, this is where my food comes from. It's not just from like the Kroger or the Meijer bag, but there's a real authentic connection there. And I just wanted to share with you all an opportunity for where we think that we're going. So we currently have those 3 locations that I stated in Ypsi, Pontiac, and Muskegon, but we are hoping to increase the footprint of this program, and we have our eyes on Trinity Health, Livonia, Livingston, and Grand Rapids as well. So would like to thank you all again for your time and would be happy to answer any questions that you may have.
Thank you again for coming in. What's your primary source of funding?
Yeah, that's an excellent question. So we have a braided funding model. We currently utilize a portion of our hospital's community benefit dollars. So the farm is a part of community health and well-being at Trinity Health. We have private philanthropists who have committed to making sure that we are able to feed as many families as we are. And then we are currently working in 2025 to partner with health plans and take advantage of MDHHS's in lieu of services opportunity. So our farm share would be considered a healthy food pack, and we will be able to offer vouchers to our farm stand in the form of almost like a gift card. So you would get that and be able to come and just shop for fruits and vegetables, and that would be reimbursable through those Medicaid managed care plans this year.
Okay, and then the folks who participate in the farm share who don't need the scholarship, does that money go back into the system, or does it just pay for their produce with the share that you have with the local farm?
So it pays for their produce for the most part. We take a very, very small overhead, mostly for the cost of our bags, and then my staff's time to do the aggregation and the program management.
Do you have any plans to expand your current farming operations to serve more folks?
We certainly hope to, absolutely.
Are there any other questions from the committee? Representative McDonald.
Just how do you go about the outreach both to local farmers, but also members of the community? Like, how do you find the people who need it, particularly seniors and people with disabilities who may not be getting out that often?
Yeah, absolutely. That's a great question. So I will kind of tackle that how do we get out into the community aspect first and then speak to the farmers section. So we have this model where we've tied in that produce to patients and that SIOH screening component. So we have good relationships and partnerships with community health workers, with social workers, our dietetics teams. And so oftentimes we are able to catch individuals that way just by maintaining those referral pathways and partnerships. But we also go down to the Ann Arbor Public Library CSA Fair. We're getting out into schools and making sure that those students are able to take home information about our programs to their parents. So that's a big driver for us as well. And we really just try to make sure that we're showing up in the community as much as possible and just getting the word out there. And then for our farmers, we're very fortunate to have a strong relationship and network with many of them. We've been running this program since 2015, and so they've got more than a decade of partnership. They know that we're going to show up with them. I have the honor of having hired individuals from the farming community, so I have employees whose title is just farmer, and they work the land, and they have good relationships with those farmers. We work with Michigan State University Extension and offer, partnerships and opportunities. And then we'll go out to events like Glexpo and just kind of get the word out on the agriculture side that this is a fair wholesale market opportunity for those farmers.
Other than your survey data, do you have any documented health outcomes that are improved as a result of the program?
Yeah, so that's actually something that we're working on this year. We were lucky to be able to grow and expand the evaluation that I just shared with you for 2025, and we have clinically integrated this program this year. So some of the data points that we're going to be looking at are changes in hemoglobin A1C. We're also running a pilot with our diabetes prevention program to understand what getting patients access to food like this early in their kind of diagnosis, maybe they have insulin resistance or just an elevated A1C level, can do for their overall health outcomes. And we also are looking at a hypertension project right now as well, in addition to maternal health equity. So there's a lot of opportunity to address that, and would be happy to bring those numbers back with you in the future.
Please.
I just wanted to add, Mr. Chairman, I'm Sean Gailey. I serve as the advocacy leader for Trinity Health Michigan. You asked about our funding model, and just wanted you to be aware we are looking to partner with the state and with you and your colleagues around a potential expansion. We're capital constrained as a health system, and we do want to see more community members served by these programs, and so just wanted you to be aware we do have a request in to partner with you around some state dollars that would help support this and help us expand. Thank you.
Okay. Well, thank you both very much for being here today. We appreciate the information and the insight as to what you're doing. Food security and access to healthy food is certainly important to both public health and food security. So great to have you. With that, there being no further business before the committee will stand adjourned.
Thank you.